Hey guys, Dr. Kyle Loveless here. Hey, I want to shoot a quick video on knee pain and your top 5 to help you with the knee pain. I'm going to make this a very quick, to the point video. Sometimes my videos are longer. I tend to go on and off about different parts of it. But I'm going to dive into this right here today, okay? So knee pain. Number one, top 5 thing I recommend for knee pain. Number one is find out the alignment of your knee. Okay, many times patients come into my office and they have knee pain. They've been to a doctor. They did cortisone shots, which I recommend no one doing unless it's severe to the point where you can't do it. You don't have any other options because it deteriorates the joints and causes osteoarthritis in your joints. But so they come in with knee pain, and many of the times it's actually a misalignment of the patella. The kneecap isn't lining up in the fossa of the knee, and as it comes through, as it tracks through, it doesn't track properly because there's a muscle imbalance, and there's too much strength on the inside, too weak on the outside, or too tight on the outside, too weak on the inside, pulling the patella off. And all it simply takes is I recommend them a knee brace that helps patella line up, and I recommend them exercises to help strengthen the vastus lateralis or vastus medialis muscle based on what the problem is. And you can tell by looking at an x-ray. You can also just look at the knees and tell and feel what's happening. But on a long timeline, that knee problem will cause something called chondromalacia, which is pretty much cartilage breakdown in the kneecap and be very painful. So look at the alignment of your knee. It also could, or the joint. It also could be your pelvis misaligned and your pelvis is rotated, which is causing you to put unequal pressure into one knee more than the other. So more weight on one side than the other, which will cause knee degeneration. So you're looking at that alignment of your knee. That's number one. The second thing, and so look at the alignment, figure out the alignment, change the muscle imbalances, get the joints moving again with good chiropractic care. That's number one. Number two thing is change your diet. Follow what's called a plant. If you have arthritis or knee pain, I highly recommend removing pasteurized breads, grains, and sugar. Okay, I'll pretty much recommend that for everything because it causes a lot of inflammation, and arthritis in your knee is inflammation and will cause knee pain. So remove those things. The best diet I recommend for straight up knee pain would be the plant paradox diet because it gets rid of lectin, which is a pesticide in plants. It also gets rid of gluten, which is really bad for your digestive system and bad for the knees as well. So that's number two, change your diet. Supplements that you can take is number three. So number three things, supplements you can take, do cod liver oil. You can go to Nordic Naturals, get a cod liver oil. That's really good for reducing inflammation in your body. Boswellia, turmeric, and ginger. There's a great supplement. I think it's called WOB enzymes, W-O-B enzymes by Garden of Life. There's lots of anti-inflammatory supplements you can take. That's a great thing to do as well. And then also making sure you're getting your knee what it needs. But bone broth is really good for your knees as well. And you can also do like MSM, and chondroitin is a really good thing you can do there as well. So those are some supplements you can do to help reduce inflammation, but also give your knee what it needs to help produce what it needs. And also that MSM, chondroitin, helps pull lectin out of the knees, which can be very painful. It's like little spikes that build up in there. So that's number three. Those are the supplements you can take. Hey, number four is get moving. Many times our knee pain is because we sit too much. Okay, so get your knees moving again. Chiropractic care is amazing for the adjustment, actually unlocks the knee. Believe it or not, your knee joint can actually what they call lock up or subluxate, where it isn't moving properly. Okay, it's moving, but it's not moving properly. And I've had patients come in where I just simply go through a certain range of motion and boom, there's a popping noise, knee releases, they get up and it's like, oh. And that same patient was told they needed a cortisone shot or they needed to have physical therapy for months and months and months, when all they really needed was to adjust the knee, start working on the muscle imbalances, which is physical therapy. So that has its place. I didn't mean to knock that. So that's number four. Get your knee moving. Start moving throughout your day. If you're sitting all day long, start moving. And also, if you're lifting wrong, you're doing things wrong in your workouts, address those as well. So that's number four, is get your knee moving. Okay, the fifth and final thing I recommend for knee pain, if it's a constant knee pain, you've tried everything else, you've done all this stuff, is test your digestive system. The gut is a crucial part of the joint health, and if your gut isn't digesting food properly, if you have a leaky gut issue, if you have low IgA levels, if you have high levels of yeast or other bad bacteria and low levels of good bacteria in your gut, your microbiome's out of whack, in other words, that can create inflammation throughout your body and cause pain. Also testing your food allergies, because a lot of times the foods you're eating, even if they're healthy foods like maybe an avocado, could be creating inflammation in your body and causing knee pain. Okay, so you look at the alignment of your body, get your knees moving, follow a plant paradox diet so you're reducing most of the things that cause knee inflammation, take certain supplements that are recommended, and final thing is get your gut tested. And also within that, get chiropractic care. It's amazing for every joint in your body. It's amazing for your nervous system health. Hey, many times your knee pain isn't just a joint pain. So if that's the case, it can be from a nerve pain. Your sciatic nerve goes right behind there. That could be causing, you could have a cyst in your knee. Hey, there's so many things that cause it, but one thing I can tell you isn't the cause of your knee problem. I can tell you this for a fact. I 100% know this. It is not the lack of cortisone in your knee. Okay, so you don't want to get an injection because that's not going to help you. All right, so that's my top 5 to health for knee pain, guys. You guys have an awesome day, and hey, share this. People need to hear it. People are cranking out these steroid injections like it's candy, and it's no good. They're taking NSAIDs, they're taking non-steroidal anti-inflammatory drugs for knee pain, which can lead to heart attacks. 20% increase of a heart attack within the month that you take it, or major drugs like they used to have Vioxx for this, or Bextra, or things like that will cause major heart problems, and also gut ulcers and digestive issues. So stay away from those things. Those aren't the answer. Even in a short timeline, I highly recommend staying away from them. Do the natural way. It'll work as long as you get someone good that'll help you. Hey, if you want help with your knee pain or any pain and joint issues at all, go to queencityhealthcenter.com and you can get our help with it. If you need help outside of Charlotte, let us know and we'll find someone for you, as we have lots of people outside of Charlotte that we can help as well.